Hello, I'm Dr. Sharon Abramowitz, and I am very pleased to be here to be able to help all of you with some ideas about how to manage anxiety and depression during these challenging times. I'm an integrative health psychiatrist, a psychotherapist, and an addiction medicine doctor with a private practice in San Francisco and Oakland. And I also teach empathic communication and motivational interviewing to health clinicians. In addition, I am a faculty member of the Academy of Integrative Health and Medicine. And I am sharing with you a slideshow that I did for them on June 26, 2020. First of all, what challenging times these truly are. There's a pandemic, economic disaster, terrible ongoing racial injustice against people of color. These uncertain times have caused a deep collective anxiety and laid bare the horrible truth that our society has failed to support so many. How can any of us possibly right now not feel some anxiety or sadness? And for those of you who are working on the front lines of healthcare, the anxiety you feel every day at work can be very overwhelming. My focus today won't be on the management of these emotions as mood disorders. Rather, in this next hour, I'm going to be sharing with you what I hope can be some ideas about how to better cope with these very understandable and natural emotional states during these difficult times. You know, the DSM, which is the psychological and psychiatric classification system, tries to separate anxiety and depression as, separate conditions. But really, they're very close cousins. One easily triggers the other, and both are really quite natural responses to stress. And because they're natural responses to stress, they actually can serve a purpose. They let us know that something is amiss within us or within our environment or a response to that environment. They're signals that we need better self-care. Anxiety is our body's natural response to stress and uncertainty, and it can be a friend or it can be a foe. It's fear, it's worry about what's to come. It may be motivating us right now to wear masks and keep physical distance, or to join in the fight for social justice, or maybe impairing us and causing us to resort to less than healthy ways to numb. Likely for many of us, it's doing both. Depression is our mind's natural response to loss. It's the manifestation of grief. And all of us are feeling grief as we lose our usual work environments, our opportunities for close social engagement and hugging and shaking hands with one another. And we're losing our spaces of recreation, places where we recreate ourselves. Those are not even available to us right now. And for some of us have actually lost loved ones to COVID. So while others of us feel the despair of daily racism, depression, of course, involves sadness, loss of engagement with life's pleasures, deflated self-esteem, social withdrawal, and low energy. Animal models have shown that stress exacerbates viral and bacterial pathogenesis, it slows wound healings, it worsens autoimmune disease, and stress hormones inhibit neutrophils, macrophages, natural killer cells, lymphocytes. These are all cells that are necessary for a healthy immune response. There's really a very complex network of bidirectional signals linking the microbiome, the nervous, the endocrine, and the immune systems. And stress disrupts the homeostasis of this network, which in turn alters immune function. And as we face COVID, at least for me, this is especially worrisome. Perhaps understanding the neurobiology of stress can help us understand how best to manage these friends or foes. Let's start with the triune model of the brain, and this was adapted from Paul MacLean and popularized by Daniel Siegel. So first, there's the mindless part of the brain. That's the part of the brain that's phylogenetically the oldest. It's our reptilian brain. We share it with many animals, including reptiles. And it enables animals to fight, flight, or freeze when they feel threat. It's based in something called the autonomic nervous system, and it's associated with body-based reactivity. And I'll talk about the autonomic nervous system in a little bit. Then there's the mind field part of the brain. That's the mammalian brain, or the limbic system. It includes the amygdala, which is an almond-shaped brain structure that sort of sprays out a non-specific fear response. Some people call it fear central. And associated with that is something called the locus coeruleus, which is dense with noradrenergic chemicals, kind of epinephrine type chemicals, and the hypothalamus. And all these things orchestrate the stress response. That stress response then goes through the striatum, which goes through the middle of our brain, and it's associated with emotional reactivity. Finally, there's the mindful part of the brain. And the mindful part of the brain is the prefrontal cortex, which is fully one third of our whole cortex, of that outer layer of our brain. It's where awareness comes through to us. As the ancients talk about, they talk about a third eye through which we can feel awareness, a greater awareness beyond ourselves. And in some ways, the prefrontal cortex is associated with that. It isn't even fully wired until the mid-20s because it is the newest part of our brain structure. And unfortunately, both anxiety, depression, even PTSD impairs the prefrontal cortex. The prefrontal cortex is associated with top-down control of ourselves. It helps us to slow down, take in what's going on before we react. So mindfulness is a way that we can strengthen the prefrontal cortex, this CEO and awareness center of our brains. And these practices don't actually take the anxiety away per se. Rather, they kind of help us to not be overtaken by the fear and stress generated from the mind field and mindless parts of our brain. It helps us to cultivate a kind of observer relationship with our anxiety and low mood. And this 2013 randomized control trial of mindfulness-based stress reduction was the first to employ an active control group to examine this form of mindfulness practice on generalized anxiety disorder. And patients who learned mindfulness meditation to observe thoughts and feelings, watch them come and go without judgment, had significantly larger reductions in anxieties than those who had only stress management education, although this too was helpful. They also had improved coping during a lab stress paradigm. A 2014 review of neuroimaging studies found meditation had a positive impact on the prefrontal cortex, the insula, which controls the autonomic nervous system and helps to regulate the immune system, the hippocampus, which is associated with declarative memory, and the amygdala, again, that almond-shaped structure in the brain that is kind of fear central for our minds. And it reduced the default mode network activity, mind wandering. And of course, the types of mindfulness practices taught in mindfulness-based stress reduction classes are not the only road to a calm mind. You can get similar lower anxiety effects when you do yoga, Tai Chi, Qigong, or concentration meditations. So I'd like to share with you all one simple meditation practice called soft belly, which I learned from Dr. James Gordon through the Center for Mind-Body Medicine. I especially like it because it includes a secular mantra that helps people to concentrate, and it really focuses on deep abdominal breathing, which really helps the mind to slow down. It's been shown to be useful for populations as varied as veterans and folks, very traumatized folks in refugee camps. So if you're open to this, let's give this a try. So sit on up, put your hands on your belly, close your eyes, and first take a very deep breath in through your nose, and then a very, very slow exhale, even slower than the inhale, out through your mouth. And as you do so, breathe down deep in to your belly so that your hands rise. So it goes like this. So now, as you do this, silently say to yourself on the in-breath, soft, and then on the out-breath, belly. And go ahead and do this. It's going to be normal for you to feel feelings, have thoughts, have distractions. That's very normal. Just kind of wake up to the distractions, notice that you're distracted, and go back to the task. And I'm going to give you a minute just to give this a little taste, okay? All right, let's try it. Okay, lovely. Now just notice where you're at. Sense if you feel any calmer than when before you started that little exercise. I know I do, and I certainly have a certain amount of healthy anxiety here because I'm doing a talk. I hope it provides the same for you. And by the way, this is showing how the mindfulness-based stress reduction had a better effect on relaxation than simply stress management education. When we talk about ourselves as mind-body creatures, it's the autonomic nervous system that physiologically makes this happen. The actions of the autonomic nervous system are not in our conscious control. They happen from the body up, from the bottom up. The sympathetic nervous system, part of the autonomic nervous system, that runs our fight and flight reactions, while the parasympathetic nervous system, which is ran by the vagus nerve, and I'm going to talk a little bit more about the vagus nerve in a second, controls our calm and freeze reactions. And I was taught that a way to counterbalance that sympathetic fight and flight reaction was to trigger the vagus nerve with slow, long, deep exhales, just as I taught you. But it turns out it's not so simple. So I want to introduce you to a theory called polyvagal theory, which was discovered by Dr. Stephen Porges, who's a renowned psychophysiologist, and it's foundational for mind-body trauma therapy. And I feel it can be really useful as we face the stress of our collective health, economic, and political traumas. Until I read Porges, I wasn't aware that there are myelinated and unmyelinated branches of our long cranial nerve, the vagus, which is, by the way, means the wandering nerve. Goes up into our heads and down through our body. Phylogenetically, the most primitive part of the autonomic nervous system is the unmyelinated branch of the vagus, the dorsal vagal complex, which extends below our diaphragm. Under extreme threat, we can't fight or flight. And then what happens? When we can't fight or flight, there's one other option our nervous system just naturally takes to help us survive, which is to freeze or play dead. Think of a bear attacking you. So this is when the dorsal vagal complex comes into play. And unfortunately for folks who have gone through chronic trauma, this can become patterned as dissociative or depression states. The myelinated branch, called the ventral vagal complex, is phylogenetically the newest part of our autonomic nervous system, and that extends above the diaphragm, and it's very specifically human. When it is activated, it enhances our ability to listen to the middle tones of the conversational human voice. It promotes sociable facial expressions. It enables our voice to be interpersonally engaging, to have a prosody. So this is known as the smart vagus, and for it to come online, our body must sense safety, which is really challenging right now. Once the body signals it's safe, it puts on its vagal brake and can bring us out of fight, flight, or numbing and freezing reactions. A way to sort of operationalize what I've just spoken about is to use something called the window of tolerance model that I learned in my sensory motor psychotherapy training. And it's a body-based trauma therapy. It's a model that I often share with patients. And it was first introduced to, by UCLA child psychiatrist Daniel Siegel, and it was put into clinical practice by psychologist Dr. Pat Ogden, who's sensory motors psychotherapy founder. So Dr. Siegel proposed that between the extremes of sympathetic fight and flight, between the extremes of sympathetic fight and flight and hyperarousal and parasympathetic numb and freeze hypoarousal is a window or a range of optimal arousal states in which emotions can be felt as tolerable and can be integrated. To get into the window of tolerance, we have to, or actually our bodies have to sense safety, which then allows the ventral vagal complex, the smart vagus, to activate. For those folks who have suffered a lot of trauma, whether it be family trauma, sexual trauma, childhood trauma, racial trauma, the window of tolerance may be more narrow. They may be more prone to being triggered into autonomic nervous system active fear reactions or dorsal vagal complex dissociated depressive states. So that's the high part of this chart, hyperarousal, where when we're up there, we feel anxious, or hypoarousal, when we're down there, we feel depressed and numbed out. Now, by practicing awareness of the physical sensations currently being experienced and really learning bodily soothing techniques, we can learn to calm ourselves, to remain in the present long enough to effectively manage the extremes of the arousal system. And this model is a great way to see where you're at in a given moment on the spectrum of emotional self-regulation. What's important is to remember is that when we're either hyper or hypo aroused, this is very important, we really can't hear each other. We really are not communicating sociability and relatedness. Remember, for the ventral vagal nerve, the smart vagus to come online, the body has to feel safe, and the body does not feel safe if it's on the extremes of this chart. So let's kind of play with this a little bit and try this out for ourselves. If you're open to it, I'd like to do with you a body scan. So we're going to check in with where you're at right now. So if you're willing, again, sit up, straighten your spine, plant your feet firmly on the ground if that's available to you, and place your hands on your lap. Now close your eyes and focus inward. Take a deep breath that goes all the way down to your belly and exhale that very slowly. Do that 4 times, just kind of like what we practice with soft belly breathing. Now that you're a little bit more centered, keeping your eyes closed and remaining in this upright posture, take a moment to reflect on what is worrying you about COVID or worrying you about the economy or the political landscape. Now let's find out where that worry has landed in your body. Let's begin with your head. I'd like you to sense your head, see what it feels like in there. Is it clear and spacious, or are you dizzy and nervous inside? Sense your facial muscles. Are they relaxed or are they clenched? Go on down to your neck and your shoulders and feel if the neck and shoulders are tense or are they relaxed. Move your awareness now down to your upper arms, your lower arms, your hands. Is there tingling? Is there a feeling of needing to move? Or is it just very quiet? Now notice your chest, or what we could call the heart chakra. Is there a lot of emotions in there, tightness? What's going on with your heart rate? Is it fast or slow? And what's going on with your solar plexus? Is that tight? Is there stress? How about your belly? What's going on in your belly? Is there a little nausea? Is there some disquiet? Or is there spaciousness? Now roam around with your consciousness in your pelvis and see what's happening there. Then move on to your upper legs, your lower legs. Sense what's going on there. And then feel your feet planted on the ground and the energy of the ground coming up through your feet. Notice where in your body that worry about COVID, the economy, or the political landscape has landed. And take a moment just to observe these physical sensations of worry. And as you do, notice if and how they change. Is your body calling on you to do anything? To maybe rub your belly, or to place a warm hand over your heart, or maybe take a deep sigh. Let your body lead you to what it needs. And when you're ready, slowly open your eyes and let yourself gently re-engage with the outside sights and sounds. And as we finish with this body scan, just notice generally how you're feeling. When we feel out of control and we're dealing with a lot of uncertainty, at least my mind does, it can become quite obsessive in here. It's a way I think we all try to trick ourselves that we have more control than we do. You know, you feel like if I get more and more information, then I'll be less uncertain. Well, how well has that strategy really worked for you? I don't know about for you, but for me, when I do this, I go down a rabbit hole and I get more anxious. Yet anxiety signals to us a healthy need to know what's going on. So my advice is pick a time to tune in, get updated, and when that time is up, move on. Now that won't take away the feelings of uncertainty. And these challenging times are just stripping bare the existential truth that this life is always uncertain. It's always transient. It's always impermanent. As Pema Chodron, the wonderful Buddhist teacher that many of us are fond of, and we love her writings and her teachings, recommends when you feel the anxiety of uncertainty, quote, acknowledge the feeling, give it your full, compassionate, even welcoming attention. And even if it's only for a few seconds, drop the storyline about the feeling. This allows you to have a direct experience of it, free of interpretation. Don't fuel it with concepts or opinions about whether it's good or bad. Just be present with the sensation. Where is it located in your body? Does it remain the same for very long? Does it shift and change? So now I want to wear my addiction medicine specialist hat. As I'm sure many of you are, I'm seeing, or many of you are suffering with, I'm seeing lots of folks self-treating their anxiety with overuse of substances or food. Shelter in place, work at home, along with the anxieties being stirred up by COVID is triggering many of us into this kind of behavior. I totally get it. I mean, I remember in late March, It was reported that alcohol sales rose by a whopping 55%. There's a lot of online Zoom happy hours going on, and any of this in moderation is okay. But for those with substance use disorder vulnerabilities, this is a really tough time. Relapses have been going up, eating disorders are flaring, relationships are facing strains due to this. The problem is that, this momentary soothing of anxiety that these habits offer us, it wears off quite quickly, doesn't it? With habitual overuse, the brain wants to reach homeostasis or balance. And when it's being exposed to a large amount of outside chemicals, it begins to downregulate the matching brain systems. Then emotional dysregulation occurs, promoting more intensified cravings. Also, and this is important, the addiction pathway runs through the limbic system, through the mind field part of the brain, and it ends up at the prefrontal cortex where it starts to cause some serious dysfunction. The important part is that the addiction pathway overlaps the brain's stress circuits. They run through the similar neuroanatomy. So stress flares up addiction and vice versa. This then disrupts the neurochemical systems we need to regulate emotions in a healthy way. And that's not to mention the hangover effects that interfere with good self-care practices like meditation and exercise. In particular, I'm concerned about alcohol's impact on sleep, a much needed commodity right now during these stressful times. And while a couple glasses of wine may help folks fall asleep, unfortunately, even these modest amounts can then wake people up a few hours later. In fact, modest alcohol use is one of the largest causes of insomnia in the United States. Then boom, in rushes all these worries, and the mind gets activated with anxiety, and it's super hard to fall back asleep because norepinephrine's running, the amygdala has fired off, the whole fear reaction thing. And working from home is changing people's sleep-wake cycle due to not getting out in sunlight enough, which we need so that our melatonin works properly and it rises properly to help us get sleepy at night, or not having a clear break between work and rest. So it's really important that you look at that for yourself and get yourself structured. When sleep is impaired, emotions, of course, become way more dysregulated. So right now, more than ever, protecting sleep is vital, and that means really good sleep hygiene. Sleep hygiene has been studied in something called the Cognitive Behavioral Therapy Insomnia Program. And this CBTI was reviewed by Cochrane Review, and they found that 36% who received CBTI for insomnia were in remission from insomnia, compared with 16.9% in the control conditions. So stay on a scheduled sleep and wake up time. Don't watch worrisome media before bed. Take downtime in low light and turn off those devices, somewhere between a half hour to an hour before bed to not disrupt your rise of melatonin. Because when you get that bright light, your brain thinks, oh, it's sunny, and melatonin goes down. So even aromatherapy with lavender can be really helpful, or light reading and listening to calming music. Guided progressive muscle relaxation is quite helpful for sleep. I really like that, and also for the times that you wake up in the middle of the night. So look for guided progressive muscle relaxation on YouTube. Get a 10 to 15 minute one. Have it available to you, and when you feel you can't sleep, lie in bed and put on your headphones and see if this will help. And if you find yourself just kind of up, activated with worries, it's best to get up out of bed. Then read or listen to music in low light until you're again sleepy. The worst thing right now is to associate your bed with not sleeping and worries about COVID, the economy, and political worries. Besides good sleep hygiene, a well-steeped cup of chamomile tea with lavender, or a good sleep blend of herbs like traditional medicinals, nighty-night tea, which includes passion flower, chamomile, hops, catnip, can be really calming during these turbulent times. Also, I've found low dose melatonin to be quite helpful right now, especially with us getting outdoors less and that lack of enough sunlight. You have to remember that melatonin has about a 2-hour delayed onset of action. So if it's middle of the night wake-ups are your problem, then take the melatonin before bed. Or if COVID is forcing you into later night shift work, this could help. So this is a photo of the plant that ashwagandha is made from, Withania somnifera. And as many of you know, this adaptogen is a revered herb in Ayurvedic medicine. As my teacher, Dr. Taroni Lodog, teaches, this herb is especially helpful for when we're wired and tired. It's well known to be helpful as an anti-anxiety herb, and going along with this, it seems to have cortisol lowering and GABA mimetic effects on the brain. The GABAergic system is the brake system of our brain. It slows things down. Some small studies have shown it to have a comparable effect to benzodiazepines. And about 300 milligrams twice a day with a good standardized dose is a good place to start. L-theanine is also helpful for these stressful times, especially for those having difficult sleeping due to tension and worries. It occurs naturally in the tea plant, and small studies have shown that it enhances actually relaxation and helps concentration at the same time for up to 8 hours. And 200 to 400 milligrams twice a day is quite effective. Also, well-steeped, calming herbal teas steeped for at least 5 minutes could be quite nurturing and helpful right now, like chamomile, kava, passion flower, or herbal teas that include lavender. As an integrative mental health psychiatrist, I find that I don't use many psychotropic medications. But for a couple of people, and I'm thinking here of a panicked frontline physician that I'm currently working with, the judicious and brief use of medications to supplement their primary mind-body work has really been helpful. A couple days of a benzodiazepine like Valium or Ativan to help someone break a bad insomnia cycle can be very helpful. And prazosin can be helpful for those being triggered by these fearful times into post-traumatic stress disorder nightmares. Or several weeks use of a low-dose SSRI may help someone with intense daily anxiety as they get other soothing habits into play. And low-dose gabapentin to use as needed for difficult to control anxiety can be reassuring to someone. The important thing for those of you who prescribe medications is to be careful not to prescribe things like benzodiazepines on a regular basis for very long. Just use them very briefly, because we don't want to create brain dependency and we don't want to create cognitive problems. And to realize these medications really aren't a true fix for what we're talking about here. For one thing, there are analyses that show SSRIs may be no better than placebo, at least for depression. And when it comes to treatment of trauma, psychotherapy is the gold standard. So I would see medications as adjunctive treatments that require both proof of efficacy and an exit plan if you're going to use them. We all know the value of exercise for stabilizing mood. A 2014 synthesis of 37 meta-analyses concluded that while exercise had only a minor anxiolytic effect, it had a robust impact on depression. And during these highly stressful times, having an exercise routine is both more vital and actually more challenging, because places we used to exercise, like gyms and pools, are closed. And it may be even more anxiety ridden, like if you go to your favorite beach or trails that you used to run or take hikes in or walks, they may be too crowded and may make you feel very nervous. The task here is to find an exercise routine during this time of COVID that feels doable and relaxing. Then stick to a workout schedule and don't fret about what you can't do. This may mean buying a stationary bike or getting home weights and joining into YouTube classes. Right now, this is the new norm, and acceptance of this decreases the anxiety you lay on yourself about not doing whatever you think is more ideal. I think it's especially important right now to really savor how you feel with regard to your emotions after you exercise. By taking the time to really notice the enhanced relaxation state that you're hopefully feeling, it reinforces that your new norm is helping you. So, for those of us blessed right now to have backyard spaces, there's something about these times that is making gardening especially soothing. I'm certainly experiencing that. And with restaurants closed, there's a lot more creative home cooking going on. There's a lot of sewing of masks. There's a lot of do-it-yourself crafts and home improvement projects going on. What is all this? Why is this all so compelling right now? It's because these things are grounding. And grounding is when we use our five senses or things we can touch to help us move through distress. It brings us concretely into the present moment. It's an awesome antidote to the uncertainty and dependency on virtual media these times are bringing us. Grounding can only be accomplished by slowing down and really savoring your food, or taking a slow walk where you bring your concentration to the sights and sounds you're seeing and hearing, by stopping and really smelling the roses. And if you find yourself distracted with anxious thoughts, you can try this. This is the 5-4-3-2-1 grounding technique. So, stop, focus on 5 things you can see, 4 things you can touch, listen to 3 things you can hear, savor that. Savor 2 things that you can smell, and maybe put something in your mouth and really notice what that tastes like. I took this photo at Tenaya Lake in Yosemite in 2018 as I began a several-day High Sierra Loop hike. And when I look at this photo, I really get a sense of such calm and peace at remembering what it was like to be immersed in the natural environment of the High Sierras. I have a patient right now in New York City who at baseline suffers with chronic anxiety. And the COVID crisis is really making her deeply miss access to open green spaces. Likely, because if she tries to go into Central Park, it feels too crowded and too threatening to her well-being. And likely those of you sheltering in place or stuck in cities with no safe natural space access because of crowds, you can relate to these feelings. We intuitively know that being out in nature is calming and healing, especially right now, with lots of online work and socializing. And this review identified 25 studies which measured a wide range of well-being outcome measures. And a meta-analysis of this data on self-reported emotions provides evidence of a positive health benefit to exposure to the natural environment, to a green environment compared to more synthetic ones, especially with regards to lowering negative emotions such as anger and sadness. And I find that really interesting. And I think that's really important right now as we feel the loss of normal life and we are grieving the loss of the ease of social connecting. And many of us are feeling anger at racism, very upset by the economic insecurity facing our population, and very angry about the mean-spirited politics, and even irritated when we watch others ignore public health guidance. So for those of you who can't get access to green environments, perhaps this is obstructing you from a way to soothe your down and irritable mood states. So if there's any way to spend some safe time in nature, even in a friend's garden, a local park at hours that aren't crowded, or to take a car journey to a less visited natural area, I think this will help you feel better. Gratitude is a practice, as we know, promoted by many traditions, including 12-step work, New Age practices, and ancient spiritual traditions. It is also a central tool of positive psychology. And positive psychology is, kind of a relatively newer field that focuses its research on what promotes well-being, happiness, and human flourishing, versus conventional psychological research, which focuses more on negative emotions and the treatment of mental health pathology. So there was some research done on gratitude lists, which are 3 to 5 things you feel grateful for this day. And that's been found to really promote happiness and life satisfaction while decreasing stress. This 2019 randomized controlled trial that involved 410 participants had these folks for 14 days before bed. A group of them wrote a list of 5 hassles, another group wrote a list of 5 neutral events, another group wrote a list of 5 gratitudes. And they found those that wrote the gratitude list had increased positive affect, feelings of happiness and life satisfaction, and less negative affect and depression. I've seen the magic of this simple tool work for me. And I've seen it work for those in early recovery, despite facing lives broken by substance use. This practice really shifted their focus to what's working today in their lives. And as many of us face isolation, infection worries, disgust with institutionalized racism, economic insecurity, and frustration with our broken political system, maybe now more than ever, a daily gratitude list is a very easy, a very doable act that any of us can do to balance our perspectives. Besides doing it at bedtime, if you prefer, and you live with someone, it's another nice time to do it is at the start of dinner. And that can be really strengthening for our relationships right now. This is a photo of President Obama with Myrlie Evers, who is Medgar Evers' widow. And just to remind us, Medgar Evers was a civil rights movement activist. He was also a World War II veteran who served in the Battle of Normandy, who was assassinated in 1963 by a white racist. And we can see here in this photo that how important social closeness now is in times, so important in times of turmoil. We humans are immensely social creatures. It is the experience of attachment that makes us human. I mean, children raised in orphanages, those poor souls who don't have a primary caretaker, they suffer great developmental problems. So it's really too bad that the COVID public health message was to remain socially distant instead of physically distant and socially close. Despite Zoom fatigue, I'm personally grateful that we have this technology during this time. It's allowing me to be here with you and to talk to you. And the highest risk group that COVID threatens, of course, are elders. Before COVID, 50% of folks over 60 in the United States were at risk for social isolation. And with COVID, that number has skyrocketed. Research shows that loneliness and social isolation are risk factors for all-cause morbidity and mortality, with outcomes comparable to other risk factors such as smoking, lack of exercise, obesity, and high blood pressure. Isolation escalates depression and anxiety. Also, loneliness has been associated with decreased resistance to infection. So here we are in a pandemic that physically separates us, and when we need each other's support more than ever. So, of course, if you're not already doing this, reach out daily to others, whether it be through a device, a distant walk, or a backyard visit with space. Who in your world really especially needs contact? Are you in enough contact with your elders? And if you're an elder, are you in enough contact with your loved ones? And, you know, when we get lonely, it's easy to become shameful. So try to overcome that shamefulness and ask for physically distanced company. Join virtual communities like these, hang out with neighbors. And then after you do that, after you have a time of social closeness with someone you care about, notice how your mood has changed. Very important to savor that and to notice that. In my view, anxiety and depression on one level are really about an existential crisis. It's worry about our transient existence in this realm. And facing COVID, racist violence, and the dark forces of our political system are startling reminders of the fragile transientness of this life. As Buddha taught, when we crave and cling to impermanent states, this is the source of suffering. So we could look at our anxiety as a tough teacher, trying to get us to wake up and remember the greater source that is eternal, whether you call it higher power, Dharmakaya, Brahman, Tao, the divine one, or God, or the boundless dimension of being. For myself, I know that when I open to this boundless consciousness, I feel immense calm. So whatever your spiritual beliefs and practices are right now, deeply leaning into these could be a great source of calm in the midst of these really troubled times. This is a Rumi quote. Dr. Daniel Brown is a Harvard psychologist and a Tibetan Buddhist scholar, and he also is my meditation teacher. And he said that research shows that the wider the vision of one's goal, the greater the perspective, the greater the psychological and social effects of one's goals. When goals are part of a larger philosophical, humanitarian, and or spiritual vision of life as lived and go beyond self-interest to the larger purpose of life that answers the question of what makes life most meaningful, life becomes more worthwhile and has inherent goodness. Folks who consistently operate out of a larger, deeply meaningful life purpose manifest a number of psychological benefits that most others don't, such as psychological well-being, physical health and wellness, strong resilience in the face of difficulties and stress, feeling more whole and integrated, genuine life satisfaction from going beyond self-interest and focusing on the greater good, a feeling of deep interconnection to others and great generativity, a greater vital engagement with life. And with regards to their relationship and work, there is a sacred calling when one is in line with one's life purpose. For many of us, COVID is slowing us down, getting us quieter, giving us time to contemplate. And perhaps, and I recognize that for many others, it's means a house crowded with people and lots of work. So, even with that, perhaps this time period, this crisis period, can give us all an opportunity to really find our greater calling, to do that which gives us passion, engagement, ultimate meaning, and serves a greater social good to make the world a better place. What a beautiful way to get beyond our anxiety and sadness. I'd like to end with my very favorite quote by Rumi. The wound is the place where the light enters you. And thank you for joining me today.